The kidney is not just a filter, it is the architect of life itself, working silently to keep your internal environment perfectly balanced and healthy every day. According to research in the Lancet, kidney disease is a silent killer, often showing no symptoms until the damage is already severe and completely irreversible for many. Over 10% of the world's population is currently living with chronic kidney disease, many without even realizing the danger they are in until it is too late. In this video, we will reveal 7 survival keys based on the most prestigious medical studies to help you detect early signs of kidney failure before it progresses. This information is not a substitute for professional medical advice, but it provides crucial insights that could potentially save your life and protect your vital kidneys today. When kidneys fail, toxins accumulate in your bloodstream, slowly poisoning your systems from within. Understanding these early warnings is your first and most vital line of defense. We will dive deep into the biological mechanisms, showing you exactly what happens inside your body when these vital organs begin to struggle and eventually fail you. Your kidneys filter about 180 liters of blood every single day. Let's explore the 7 silent signals they send when they urgently need your help. Pay close attention to your body's subtle language. The first signs often appear in the most common daily habits, starting with your very own morning bathroom routine. Sign number 1, foamy urine that doesn't disappear. This suggests that protein, specifically albumin, is leaking out of your blood and into your waste stream for excretion. Healthy kidneys keep protein in the blood. When the filters are damaged, these large molecules slip through, creating a texture similar to beaten egg whites in the toilet. This condition, known as proteinuria, is a major red flag. If you see persistent bubbles in the toilet, it is time to consult a doctor immediately for testing. The foam may look like the suds you see when scrubbing, but it indicates a serious breach in your body's most important filtration system right now in time. Sign number 2, swelling in your ankles, feet, or hands. This occurs when your kidneys can no longer effectively remove excess sodium and water from your body. When sodium builds up, your body holds onto water. Gravity pulls this fluid down to your lower extremities, causing visible and uncomfortable swelling throughout the entire day. You might also notice puffiness around your eyes, especially in the morning. This is due to protein leaking into the urine, which changes your body's fluid balance. The Journal of Nephrology highlights that edema is often one of the earliest visible clinical signs that the renal system is struggling to maintain internal fluid balance. Try the pitting test. If you press your finger into the swollen area and the indentation remains for several seconds, your body is retaining too much toxic fluid. High sodium levels increase blood pressure, which further damages the delicate vessels in the kidneys, creating a dangerous cycle that is very hard to break later on. Monitoring these physical changes is essential. Swelling isn't just about appearance, it's a sign that your heart and kidneys are working under extreme and dangerous pressure today. Fluid can also accumulate in the lungs, making it much harder to breathe. We will discuss this further. But first, let's look at your daily energy levels. If you find yourself constantly exhausted despite getting plenty of rest, the cause might be hidden deep within your blood and your decreasing kidney function right now. Sign number 3, extreme fatigue and weakness. Healthy kidneys produce a hormone called erythropoietin, or EPO, which tells your body to make oxygen-carrying red blood cells. When kidney function drops, EPO production falls. This leads to a decrease in red blood cells, a condition known as anemia, leaving you feeling constantly drained and weak. With fewer red blood cells, your brain and muscles don't get the oxygen they need. You may feel dizzy, weak, or simply unable to concentrate on simple tasks. This isn't just normal tiredness. It is a deep, cellular exhaustion that doesn't go away with sleep, indicating your internal organs are struggling to survive each day. Medical experts often check hemoglobin levels in kidney patients. If you are persistently tired, a simple blood test can reveal if your kidneys are the underlying cause. Sign number 4, dry and itchy skin. This is often dismissed as a dermatological issue, but it can be a sign of advanced mineral and bone disease. When kidneys fail to maintain the balance of minerals, especially phosphorus, these elements can build up in your blood and eventually deposit under your skin's surface layer. This causes an intense, persistent itch that feels like it's coming from deep inside. It is your body's reaction to the toxic buildup of metabolic waste products. Research published in Gut suggests that the uremic itch is a complex symptom involving both the nervous system and the accumulation of toxins in the body tissues. You might notice your skin becoming unusually dry, flaky, or even developing a grayish tint as the kidneys lose their ability to filter the blood properly today. If moisturizing doesn't help and the itching is widespread, it is a clear signal that your internal trash disposal system is no longer functioning as it should be. Sign number 5, a metallic taste in your mouth and breath that smells like ammonia. This condition is medically known as uremic fatigue, caused by urea buildup. When kidneys can't remove urea, it builds up in the blood. Bacteria in your saliva break this urea down into ammonia, creating that distinct metallic or chemical odor. You might also find that food tastes different, or you lose your appetite for protein-rich foods like meat, as your body associates them with toxic byproduct buildup. This change in taste can lead to weight loss and malnutrition, further weakening the body's ability to fight off the progressing stages of kidney disease and failure. If you notice a persistent, metal, taste or others comment on your breath's chemical scent, your kidneys are likely struggling to filter out nitrogenous waste products now. Sign number 6, shortness of breath. Even with minimal exertion, this can be linked to the kidneys in 2 very specific and dangerous ways you should know. First, extra fluid that the kidneys can't remove can build up in the lungs, a condition called pulmonary edema, making it difficult for you to breathe deeply. Second, the anemia we mentioned earlier leaves your body starved for oxygen. Your heart and lungs have to work much harder to provide oxygen to your vital organs. You might feel like you can't catch your breath after climbing a few stairs or even while lying down flat at night, which is a very serious symptom. This fluid overload can lead to chest pain and pressure. It is a sign that your cardiovascular system is being overwhelmed by your kidneys' inability to filter blood. When your blood is thin and your lungs are heavy with fluid, every breath becomes a struggle. This is a critical warning that requires immediate medical attention. While many kidney issues are painless, there is one specific type of physical discomfort that can point directly to a problem with these 2 vital bean-shaped organs. Sign number 7, pain in your back or side, specifically in the flank area. This is located just below the rib cage on either side of your spine. Unlike typical back muscle pain, kidney pain is often deeper and sharper. It may radiate down toward the groin area as the condition progresses or becomes more acute. This pain can be caused by kidney stones, infections, or polycystic kidney disease, which causes large, fluid-filled cysts to grow and stretch the kidney's sensitive outer lining. If the pain is accompanied by fever, chills, or blood in the urine, it is a medical emergency that indicates a severe infection or a large obstructing stone. You can perform a simple check. Gently thump the area on your back where your kidneys are located. If this causes a sharp jolt of pain, consult a professional. Remember, your kidneys are tucked up high under your lower ribs. Pain in the very low back is usually muscular, but flank pain is a serious renal warning. The nerves surrounding the kidneys are sensitive to stretching. When a kidney is swollen or inflamed, these nerves send intense pain signals directly to your brain and spine. Do not ignore persistent discomfort in this region. Identifying the cause early can prevent a simple infection from turning into permanent organ damage or total kidney failure today. Doctors often use imaging like ultrasound to look for physical changes in the kidneys when a patient reports this type of localized and persistent flank pain in the back. Inflammation is the body's way of saying something is wrong. In the kidneys, chronic inflammation can lead to scarring and a permanent loss of the vital filtration function forever. Now that we have covered the 7 signs, let's look at what the latest global medical research says about protecting your kidneys and preventing these symptoms from appearing. According to the Journal of Hepatology, the link between high blood pressure and kidney health is inseparable. Controlling your blood pressure is the single best way to protect them. Doctors measure kidney health using the glomerular filtration rate, or GFR. This number tells us how well your kidneys are filtering waste out of your blood every minute. High blood pressure acts like a pressure washer inside your delicate kidney filters, eventually tearing the microscopic vessels and leading to irreversible scarring and loss of function over time. Sodium is the enemy of healthy kidneys. A high-salt diet forces the kidneys to work harder to remove the excess, leading to increased pressure and faster organ aging. The renal diet focuses on foods like bell peppers, cauliflower, and garlic, which are low in potassium and phosphorus but high in protective antioxidants for your filtration system. Diabetes is the leading cause of kidney failure worldwide. High blood sugar levels damage the kidney's filters, causing them to leak protein and eventually fail completely over time. Your kidneys are incredible machines, filtering 180 liters of blood daily. To keep them running, hydration is key, but don't overdo it with excessive water intake. While protein is necessary, an excessive intake of red meat can increase the acid load on the kidneys, making them work overtime to maintain the body's delicate pH balance. Be cautious with over-the-counter painkillers like ibuprofen. Frequent use of NSAIDs can reduce blood flow to the kidneys and cause sudden or chronic damage to the renal tissues. New research highlights the importance of early screening. Simple blood and urine tests can detect kidney issues years before the physical symptoms we discussed even begin to appear. Protecting your kidneys is a lifelong commitment. By making small changes to your diet and lifestyle today, you can avoid the devastating consequences of kidney failure in the future. Your kidneys are silent workers, but they do send signals. If you recognize at least 2 of the 7 signs we've discussed, please schedule a checkup immediately today. Let's recap. Watch for foamy urine, swelling, fatigue, itchy skin, metallic breath, shortness of breath, and flank pain. These are your body's early cries for help and attention. A simple creatinine blood test and the urine albumin test are the gold standards for checking your kidney function. They are quick, easy, and can provide total peace of mind. Lower your salt, manage your blood sugar, stay active, and avoid smoking. These habits create an environment where your kidneys can thrive and function perfectly for many decades. Listen to your body. It knows when something is wrong before your mind does. Early detection is not just a choice, it is your ultimate survival strategy for health. Please share this video with your loved ones. Kidney disease affects millions, and spreading this knowledge can help someone get the help they need before it is too late. Your health is your greatest wealth. By protecting your golden filters, you are ensuring a future full of energy, vitality, and well-being for yourself and your entire family. I am your health scriptwriter. Thank you for watching, and I look forward to seeing you in our next journey toward a healthier and more informed life. Goodbye.